Hi, I'm Tim. I'm a sports and holistic therapist, and I'm here with my colleague Holly to show you how to use the TEND vibrational device for dealing with neck and shoulder pain. Often 9-to-5 office jobs, people are sat and they tend to be in a slouch position. This puts a lot of tension and pressure onto the neck and to the shoulder, and also tightens up the front of the shoulder. So what we're going to do is we're going to get Holly into a relaxed position and just start off gently working into the front of the shoulder, into the pectoralis minor muscle. By freeing that, we can allow the shoulders to go back. Start off just where the tight area of the pec minor is, so it joins just below the bone. We're going to vibrate gently across the muscle, and as we do that, move it slightly down towards this insertion in the chest. Sometimes 10 to 15 seconds is sufficient on the lowest setting, but if you have something that's a little bit tighter, you can up the setting to a bit more vibration, and it just gives a deeper penetrating vibration, which helps the tissues just settle down a little bit better. It means you don't have to press on as hard, but you can get just as good a result. Having worked on the front of the shoulder, allowing that shoulder to settle back, we're looking then into the neck, the tension that comes down through the neck into the shoulders, into the trapezius, and then down the medial border of the scapula, the side of the spine. These are the areas that people regularly talk about having knots and tension, and they can also be a regular cause of headaches and migraines. On the first setting, I'm going to work into the shoulder, into the trapezius, and gently work that muscle across up towards the neck insertion. And again, you don't need to press this too hard, you just need to be getting some stimulation into the muscles. And just by turning away gently from me, I can see the tension through into Holly's neck there. And you can work your way through and find the spots that are the tightest. Again, that's where I would put on the vibration. So we don't need to move very much further from that specific spot. And it helps the muscles settle down a lot quicker. And you can feel the change in the tissues just with your thumb. So having worked in the neck and the top of the trapezius, the other area you tend to find is down the side of the scapula. So I'm going to do exactly the same in there. Again, 10 to 15 seconds is often enough. And you find as you work through the muscle, tension starts to dissipate and you can slide a lot better, and those little areas of snags that were previously tight muscles are just softening. And as the muscles relax, a lot of the pain and tension will decrease with it, and the cause of headaches is reduced. Having shown how to use the TEND on Holly's shoulder and neck, I'm going to show you how easy it is to get into those same parts yourself. I would work gently into that part of the arm, from the shoulder down into the pectoralis minor, and just get a nice sensation and gently press in until that pain sensation softens. You can do the same into the neck and shoulder. I spend a lot of my time leaning over people in the clinic, so this is an area that gets quite tight for me. And I find that 2 or 3 minutes and the tension's gone. Again, you would work from the neck down towards the shoulder. Being a small device, it's really easy getting to those niggly areas that I find quite problematic with a massage gun. But being small, you can pinpoint the areas exactly as you need them.
Hi, I'm Holly, a sports and holistic therapist. This is Tim, and I'm going to be showing you how to use the TEND machine today on calf tightness and pain. So I'm going to show you how to do it on somebody else, and then I'll show you how to self-massage as well. So to start with, all I'd like you to do is just warm the area up by just massaging, just getting in there with some oil. Just get the blood flow moving into that area. And then what you want to find is the tightest part of the muscle. One click on the TEND machine, and you're just going to place that into the tight part of your calf. You don't want to put too much pressure into it, just a light touch. And then what you can do is you can start running it down towards the bottom of the leg. Once you've done that, you can always up by pressing the top of the TEND machine, and if you've got an area that's really tight, you can just hold that on there. So I like to do the outside of the calf, and depending on where the tightness is, you can also come onto the inside of the calf. Again, knocking it down if you need to for the vibration setting to desensitise that area again. Going all the way down towards the Achilles. You can come into the side of the Achilles. Again, this is just on the lowest setting. Do both sides. So I'll just show you on this side. On the inside of the calf, all you're going to do is same as the other side, just bringing it down. If there's a tight bit of muscle, you can just hold it. If you've got a very stubborn piece of muscle, you can put it onto the pulse setting and just hold it into that area there, and it will pulse into the muscle tissue. So I've shown you how to do it on somebody else, now I'm going to show you how to do it on yourself. The great thing about this is you don't need to have bare skin, you can do it over clothes. So it's the same principle, turn it onto the first setting. I like to start right in the centre of my calf and again run it all the way down from top to bottom. You can choose what speed you'd like to go at this as well. It doesn't have to be fast, it doesn't have to be slow, just however you feel it. We'll go on the inside and to the outside. And the good thing is you can feel this yourself, so where you find that you're a little bit tight or a little bit tender in one area, you can go back to that area, hold the tender machine onto it. You can change the setting so it goes a little bit deeper, or one of the things that I love about this machine is that you can put it onto the pulse setting and just hold it there, and what that does is it goes in and out and it just gets deeper into that muscle tissue. And then if you want to finish off the rest of the massage or the treatment, you can go back to that first setting again by turning the machine on and off again.
Hi, I'm Tim. I'm a sports and holistic therapist, and I'm here with my colleague Holly to show you how to use the TEND device on painful forearms and elbows. The muscles in the forearm feed up into the bones on either side, the lateral and the medial epicondyle, and you can get a condition that's known as tennis elbow, when you've got tension in these muscles that get very tight as it comes and joins at the bone. The same thing on the forearm, the tension comes up through the forearm to the bone where it joins here. So we're going to use the TEND device to help loosen up these muscles and get rid of some of the tension that sits there that's causing the pain in the first place. So I'll turn the device on, first setting. The easiest way is just to actually feel across the arm. I can see with Holly she's really tight there. So I'm going to start around that area but not directly on it. So we're going to move into the muscles that work towards that tight spot, gently up the arm. And I can even feel with the TEND it's just a little bit tighter there, so I'm going to work around it for 10 to 15 seconds and just get the muscles to start relaxing and responding to the light vibration. As it softens, I can feel the TEND slide a lot better through the muscle, and I can see that it's softening. So I can turn that setting up, use it a little bit higher, and just get the muscles to normalise this vibration sensation. And the muscle will then start to gently relax. Because we've got tension up into the bone, we can work right up in the top end of the tendon, but obviously avoiding the bone itself. I personally would just put my thumb over the top just to protect that area and work gently through the tendon area, just stimulating the blood flow underneath and then back down into the muscle again. Where there's a particularly tight spot that I identified earlier, it has settled a bit, but I would turn that onto the pulse setting, which means I can hold it right into that very specific spot and it will send a nice pulse into the muscle. You don't need to move the TEND very much, but equally you can just slide it through there. And it's normalising that nerve sensation that causes the pain. We can do exactly the same if I put it back onto the first setting on the inside and work through, find the tender areas and just gently massage towards and around. And you'll sometimes see that the muscles will tighten a little bit as you go over and the hand will move or the fingers will tighten. That's perfectly normal, that's just the muscles and tendons that make that hand move as it does. So by relaxing it, we can work through the muscle and keep that tissue soft in there. And that's how you would use it on the forearm to deal with tennis elbow, golfer's elbow and the like. Okay, so I'm going to show you now how you would use the TEND device to help with forearm and elbow tension, often called tennis elbow when it's up on the outside of your arm, or golfer's elbow if it's on the inside of your arm. And that's often caused by muscular tension that's pulling where the muscle joins against the bone. So the aim with the TEND is to get it onto a light setting. You can feel yourself where the muscle tension lies and gently place the TEND into that area, work it up towards the bone until you get a nice sensation. The pain will start to dissipate slowly as the muscle relaxes. Now you can increase the speed settings for a bit deeper massage, and you should just be guided by the amount of pain or discomfort that you've got, or the amount of tension that's in your muscles. If you need to find a specific spot that's causing you pain, you can increase it to a pulse and just hold it in that one spot for a short while, and that'll help the muscle tension dissipate. Now you'd work it exactly the same way, looking at the inside of your arm for the golfer's elbow, work into the muscle on the forearm there, and in a similar manner just gently work your way up towards the epicondyle on the inside. That's this bony section here. And again, finding any area that's tight, you can work a little bit more deeply into it. And any specific areas, again, you can put the pulse setting on and just hold it in that same spot for a few seconds. And that's quite simply how to use the Tend on elbow and forearm pain.
Hi, I'm Holly, and today we're going to show you how to use the Tend machine for ankle and heel pain, including plantar fasciitis. So what I want to do is I want to start on the top part of the Achilles. So I'm going to pop my Tend machine onto the first setting. I'm just going to palpate the area with my hand to start off with. You can refer back to the calf video that we also have before this if you'd like to do that, just to sort of get the whole calf ready for the next part of the step. So straight in the middle of the Achilles where it inserts into the calf muscle, I'm just going to slowly work my way down. Just be aware of any pain at all. I'm just going to go medially into the Achilles and laterally again into the side of the Achilles there. And then if the pain's okay, I'm going to pop it up a notch, just press it once. Some small circular movements all the way down the Achilles and then into the side again. Just making small circular movements. So I'm going to come onto the heel. Again, first setting, I'm just going to put it right in the centre of the heel there. Not with too much pressure at this moment. Again, the vibrational pattern of the Tend machine gets quite deep into that tissue for you, so you don't have to put too much pressure in. And then I'm going to make some circular movements. I'm going to start slowly and work bigger and change to the other way. Again, be aware of any pain in this area, it can be quite tender. And I'm going to work into the foot, so I'm going to go from the outside of the foot through to the middle and then onto the inside. So again, making sure it's just on the first setting, on the outside of the foot here, all the way back up to that heel. Again, you can do this a couple of times. I'm going to go into the middle and onto the inside. So this can be quite tender, so you just want to sort of desensitize to the touch, and then if you feel like the pain's okay, you can put the vibration up a little bit. However, right now I'm not going to do that because I can feel that Tim's foot is responding quite well. So as you can see, I'm just working my way from the middle to the outside of the foot. What you can do at this time is, if you found a spot that is quite tight, so I'm just going to come back down to here, and I'm just going to ask Tim if he'll just flex and extend his, just his toes. There we go. So he's working his toes and doing some active movement into that area, again on the lowest setting. Okay, so now I'm going to show you how to use the Tend machine for plantar fasciitis or pain that's at the bottom of your foot and going into your heel. So we're going to start just where the Achilles comes into the calf area. So we're going to just first setting, just get that into there, straight into the Achilles. This can be quite a tender area, so just have it on the first setting to start off with. If you need to, you can always do a bit of a self-massage first with just some basic oil. So we're going straight down through the Achilles into the heel and back up again. What I really like to do here as well is I get the Tend machine with the pointy end again on the lowest setting and just get right into the side of the Achilles, just hold it and then start to move it up and down again. You can do that on both sides. Once you've done that, you're then going to put your foot flat so that you can see the sole of your foot. And I like to start in the heel, straight in the sole of your heel. I like to do some circular motions here, starting quite small and getting bigger, and then again in the opposite direction, bringing it back down to a smaller circle. What I like to do from this is work on the outside of my foot, and I'm going to start from just underneath my little toe all along the inside, and I'm going to do it in 3 patterns like this. Just underneath the little toe, taking that all the way through, all the way down. You'll find some spots that may be more tender than others. You don't need to put too much pressure onto them because the TEND machine is going to be putting the vibration therapy through that zone, and it'll ease the tension in that area. So a couple of strokes on each, then we're coming into the middle. Again, if you do find an area that is a little bit more tender, you can just hold that machine straight onto that spot and then continue again, following the pathway. I like to hold it just where I've got just that little bit of pain, so I've got a little bit of pain there in my foot. So I'm just keeping it on the basic setting because that's quite tender, and once that tenderness disappears a little bit, I can just pop it up and the intensity increases.